Welcome to Pennsylvania in Focus. I'm Kristen Smith. Pennsylvania House members say that aging in place is a major priority for them as the state's elderly population continues to grow. Home care services deemed unskilled to support daily activities like bathing, dressing, and cooking are essential to creating that possibility for them. Yet providers across the state are struggling to hire enough staff to cover the needs of the state's 300,000 home care patients. Unable to offer comparable hourly wages, the industry is losing its potential recruiting pool to gig work and jobs in the service industry. Joining me today is the Center Square's Pennsylvania reporter, Christina Langell. Christina, first, what exactly is home care, and how is it different from other services that are provided to senior citizens and disabled residents?
Home care is service that is not considered skilled labor. So it is work like preparing meals, assisting with bathing, assisting with dressing, kind of getting those sort of household and personal needs met that does not require any kind of medical knowledge or degree. So it's distinct from home health care, which is when you have nurses coming in to provide medication or to do checkups or even work in shifts, which you see a lot more frequently with people who are experiencing more significant health issues. Or, you have physical therapists, occupational therapists, all kinds of people who fall into that healthcare realm who would come into the home to perform a service and then leave. The home care staff is more working on those sort of day-to-day tasks. And because of that, because they aren't medical professionals, it's a bit of a different staffing pool that you're looking at. And importantly, home care staff are the people who spend a whole lot of time with individuals who are experiencing medical issues and living in their homes or the aging. So those are the people who get really close to families often. They tend to know the most about what's going on with the patient, because where a nurse or other type of like an OT or a PT comes in very briefly and does their work and then goes on to another patient, there's a relationship that's built and more time spent with the home care staff. So it's a really vital role in terms of the family and community.
So talk a little bit more about these factors that are contributing to the industry's staffing crisis.
So the biggest problem is probably pay. When you are looking at people who can fill these kind of roles, you're also seeing a lot of other jobs that require the same sort of skill set that are paying a lot more. So if you're able to connect with people and have a nice conversation and act in a serving capacity, then you're probably also very capable of serving in a restaurant or in a retail setting or at a gas station or driving an Uber or doing all kinds of things that are paying oftentimes $20 or more per hour. Home care staff make on average between $13 and $14 an hour. And it's in many ways a very difficult job. You're working in someone's home, so it's always kind of on someone else's terms. And you're doing hard work and you're doing emotional work. So it's a lot. And it's easy to see, why someone might choose a job that's a little less stressful for a little more money. Another factor is just the demographics of the state. So as we know, we have an aging population, which is contributing to how many people need home care. And it also means that there are fewer young people to provide that home care. So it's just sort of a disproportionate level right now. And then you see the same sort of issues that you have with certain other industries where people are going to nearby states because they can't earn as much in this field. So there are a lot of people who really love doing this kind of work. And even among them, there can be better options in states that have a higher pay rate.
And what role does Medicaid reimbursement play in all of this?
Medicaid has a huge role in this. Medicaid is the only way that home care is paid for other than people paying for it out of pocket themselves. So Medicare does not cover home care, and private insurance generally does not cover home care, unlike home health care, which are both covered by both of those things. So what Medicaid is able to cover sets a threshold for how much they're able to pay people. In Pennsylvania, the Medicaid reimbursement is capped at $20.63, which means that the providers have to be able to cover all of their costs with that $20.63. So that includes hourly wages, benefits, and overtime. So that's why you see that $20 turn into $13 to $14 for the person's hourly rate. In every contiguous state to Pennsylvania, there's a much higher rate by upwards of at least $4.50 of Medicaid reimbursement. So that's something that advocates really want to see change. If it goes higher, then they'll be able to pay their workers more and hopefully incentivize more people to do the work.
Christina, thanks for joining us today. Listeners can keep up with this story and more at thecentersquare.com.